finances, the safety and the health of our loved ones. And therefore, I would like to give you some pointers on how we can take back control and reduce that anxiety. The first thing you can do is to vaccinate, because that's one of the most important things we can do to make sure that our immune system is able to respond and protect us against serious COVID infection. What you can also do is to keep your immune system healthy, so you can exercise. Drink enough fluids, stay away from alcohol and from substances of abuse, get enough sleep, and spend time with your loved ones instead of looking at social media and the TV with all its negative, overwhelming information that we're getting and all the false information we're getting. And then lastly, if you are struggling with depression, anxiety, distress, grief, or sleeplessness, there are people that can help you. You can contact a psychological counselor, a clinical psychologist, or a psychiatrist, or you can visit your doctor, because mental health matters and mental health problems can be treated. Remember, love protects. Do your part and please vaccinate. Thank you.
So thank you and welcome to the Love Protects Conversations with our panel of experts. I'm very excited for a number of reasons. The first reason I'm excited is because of the quality of the experts around the table and the ones who will be joining in online. The second reason I'm excited is because we're going to change the format. You'll notice that today we are focusing on everything you need to know, because there is so much information about COVID, it's all over the place, and we want to address almost all the topics that we saw are important, because now a lot of the questions are becoming repetitive, and we'll start playing clips on our Facebook platforms of the relevant issues that have already been addressed, as opposed to having weekly engagements that keep on talking about the same issues. What I'd also like to say is, in the last 4 or 5 weeks, we've really gone through all of the topics. I remember Dr. Bruvet was our first guest when we spoke about COVID, its impact, vaccines. We had one on long COVID. We had one on mental health, where Dr. Belinda Bruvet was a specialist psychiatrist, was also present. We're having the one today with all of the information. So thank you and welcome. Thank you and welcome to this chat. We are going to go through a review of what has been done. And once we go through that review, I will be introducing each guest. And then we've also got a special guest who will be dialing in from overseas and who has a special message for Namibians regarding COVID. So I think if that review has already been done, I'm not sure if it played on the screen or not. I'm going to start introducing our guests. At my far right, we've got a specialist psychiatrist, Dr. Kisa Mwambene, who is going to talk about our mental health considerations. Then we've got Frederico Links. He's the editor of Namibia Fact Check. And I really just want to thank you for the incredible work that you're doing, Frederico, because we rely a lot on that when we are faced with people who are spreading misinformation. Then we've got Mrs. Alka Batia, who's the UNDP's representative to Namibia. She'll also be talking about vaccines. Many of you by now know Dr. Willy Bruvet. He's a specialist physician. He's a pulmonologist. He always says, just say I'm a lung specialist. And he's really been on the front lines of the COVID response, obviously because of his speciality. Welcome, Dr. Bruvet. And then we've got Dr. Gordon Cupido, who is the head of Department of Internal Medicine at the Karatura Hospital. He's also a physician and an infectious disease specialist. And that's why I say I'm so excited about the quality of panelists. Online, we have Dr. Nelaro Amarulu, who's the medical superintendent at the Karatura Hospital, but she's also an obstetrician and a gynecologist. And most excitingly, we've also got Dr. Soumya Swaminathan, who is the WHO chief scientist. And it's fantastic to have her apply her formidable brain to the Namibian-specific issue. And she has a special message for Namibians. And we're very, very grateful to Sheila Rousseau and our colleagues from WHO Namibia who facilitated this exceptional intervention from Dr. Swaminathan, who's the global WHO vaccine specialist. So I think we're going to lead straight into the video from the WHO scientist.
Greetings from the World Health Organization. I'm Dr. Soumya Swaminathan, the Chief Scientist, and it gives me great pleasure to be with you today. And my special thanks to the First Lady, Madame Monica Gingos, for inviting me to participate in this wonderful dialogue called Love Protects. I think it's such a wonderful theme because this COVID pandemic has taught us one thing, and that is that we're all in it together. Whichever country or race or creed or religion or ethnicity we belong to, the virus impacts us as human beings, and therefore we need to respond as one. I just want to, first of all, express my empathy and solidarity with the people of Namibia who are going through a difficult phase. And you're not alone. Many, many countries in the world, in different regions of the world, in fact, WHO has observed that in 5 out of 6 WHO regions, cases are increasing, and many countries are facing third waves, fourth waves. And that's because of a few reasons. The first one is that we have this new variant, the Delta variant of this virus. As we all know, this virus is very clever. It keeps on mutating and changing itself. It keeps evolving because it wants to get fitter. It wants to become stronger and more transmissible. And this Delta variant is definitely more infectious than the previous ones. So previously, one infected person could infect 2 or 3 people. Now, one infected person can infect 8 people. And this is why the virus is spreading so rapidly. It's spreading through families and communities, and why it's so important for us to be even more careful and take all the precautions that we know help. So maintaining a distance from another person of at least 3 feet really helps. Having a face covering, a mask on, which covers the nose and mouth properly. And if everyone wears that, it can have a huge impact. And one thing I'd like to say is that till you get the vaccine into your arm, the mask is the best vaccine that you have. So please keep masks on, whether you're coughing or not coughing, or you feel perfectly well. Even if you're vaccinated, please do keep your masks on, especially when you're with a lot of other people, especially when you're indoors with poor ventilation, and especially if you cannot maintain that distancing. We know that in many countries that people cannot maintain physical distancing because of the way in which we live and in the way in which our societies are constructed. So mask can help protect us, and it can be ordinary cloth mask. It has to be clean, it should be washed, and it should be handled carefully, not soiled, not thrown here or there, and certainly no exchange of masks between people. So we all need to do that because the Delta variant will find every opportunity really to infect us if we allow it to. Secondly, it's the adherence to these measures. We're all tired. We've been doing this for more than a year and a half now, and it's very difficult to continue to adhere to these measures. But please, we need to for some more time. If you're feeling well, please don't go out, stay at home, get tested, and try to stay isolated as much as possible for the first week to 10 days. And we know it's a respiratory virus, that's how it spreads. So we have to make sure that we have good ventilation in our homes, keep the doors and windows open, and any meetings that need to be held, have them outdoors where you can be a little more spaced out and where there's fresh air, which is much better than being indoors with a lot of people, especially in a confined setting. The third reason are the public health and social measures. Many governments, have had to relax them because of economic compulsions. So we need to find a balance between having those regulations and rules in place where we are trying to avoid people from mixing. Certainly, mass gatherings should be avoided, and any activities which are not essential activities should be avoided at this stage because Namibia is going through currently a crisis with a huge increase in cases compared to the population. We find that the numbers of cases are increasing, and when the numbers increase, deaths will also increase, unfortunately, because health systems get completely overwhelmed, and there's only so much that doctors and nurses can do, and there's only so much place in the hospitals and in the ICUs, and there's only so many oxygen cylinders, ventilators, etc. available. So we need to make sure we're not filling up the hospitals. One thing we've seen is that in countries like Namibia, majority of people who are infected are young. So they're between 20 and 49 years of age. And that's a good thing in a way, because young people are less likely to get ill. And data that we've seen from many African countries suggests that a lot of people have been infected without knowing that they've been infected. So that's good that African population is young, so it's relatively less likely, but young people also get ill. They end up in the hospital and can get into very severe disease. So it's best to be very, very careful. And finally, it's about vaccination. That's what's going to protect us in the long run. It's wonderful that we have so many vaccines that are so effective and safe at preventing COVID, severe disease and infection. So vaccines will help countries, communities, people, all of us to come out of this pandemic. We need to speed up vaccination as much as possible. I know that the government is doing everything it can to increase the vaccination, but people need to do their bit as well. So everybody who's eligible and everybody who can get a vaccine must get it and must get the complete course. So the 2-dose vaccine course means that you must go back and get your second dose whenever the government is asking you to come back and get your second dose, and that will protect you. Even if you get the infection, you're not going to get ill, you're less likely to spread it to others. So it's good for you, it's good for your family members and your loved ones, and it's good for the community. So with those few messages and words, I want to wish you all strength and courage, and I hope that Namibia comes out of this situation quickly, but it really needs the cooperation of everyone and the ability to work together. Thank you so much, in solidarity with you. Bye-bye.
So we really appreciate the solidarity of Dr. Swaminathan and the WHO for what we're currently going through in relation to our third term. It was fantastic to hear observations, particularly on young people. But it's also going to be fantastic to hear the observations of this incredible panel of experts, and each one is going to take about 3 minutes to just go through what their professional observations have been. I can see Dr. Cupido is looking away and hoping that I don't start with him. So Dr. Cupido, I read your cue. So I'll start on my right-hand side with Dr. Mwambene, and then we'll go through this way. Just a highlight of your key observations.
Okay. Generally, I can say with COVID-19, when it comes now to issue of mental well-being of individuals, there is a lot of fear, a lot of worries when it comes now to COVID-19. So this has created a lot of anxieties within our communities. There is a lot of fear when it comes to fear of getting the infection. And then because of that, people, they have a lot of anxiety. And when it comes now to anxiety, because there's a stress, then develop anxiety. This lead now to weakening the immune system. And by doing that, now it made this somebody more prone or more vulnerable now to get the infection. And also for those who have already got infection, there's a fear of dying, fear of death, fear of leaving the loved one, especially the children, the spouse, the parents. You know, so this fear also create anxiety. And this anxiety, as I said earlier, it's keep on weakening the immune system. And by doing so, then it complicates even the outcome of the disease. And some, they can have overlap of the symptoms. when now they develop a full-blown anxiety. Anxiety is a mental disorder, but it has the symptoms that mimic the physical disorders. And overlap of these symptoms really complicate the picture of the COVID now to the patient who is now suffering from the COVID. Like the symptoms like anxiety can have symptoms like headache, which COVID also has headache. Anxiety can have symptoms of chest pain, chest tightness, shortness of breath, which also COVID has all those symptoms. Anxiety can have symptoms of general body weakness, which also anxiety have those symptoms. So you find that the more anxious they are, they go into developing now a full-blown of anxiety. Now they have also the really physical condition, which is COVID. Now the symptoms overlap, and this complicate the picture of the COVID-19 and keep on weakening the immune system and lead to poor progress of the disease.
Thank you. And the relationship between anxiety, fear, and COVID is fascinating. So thank you for sharing that. And we'll move to Frederico Links, who's the editor of Namibia Fact Check, and he's going to take us through his high-level observations about the trends that he's noticing on misinformation.
Yeah. And I think I'll sort of use as an entry point the whole anxiety and fear issue. I mean, that's exactly what is driving a lot of the disinformation and the misinformation around COVID-19, around the vaccines at the moment. And that's what the disinformation, the people who create this sort of content, that's what they count, the anti-vaxxer movements and so on. And I mean, it was anxiety and fear. If you remember the young woman in Walvis Bay early last year who committed suicide because of the conspiracy theory that 5G was causing COVID-19, and she thought this tower outside her window was a 5G tower, even though we don't have 5G technology in Namibia at the moment. And then she committed suicide. Now, I mean, there was mental illness, I think a history of mental illness there, but it was also anxiety that fed her mental illness, being cooped up, because it was the early part of our that first lockdown and so on. And really how we can lessen anxiety and fear. I mean, Dr. Brevet, who spoke in that opening clip, very aptly pointed out, you know, for a lot of us, the information overload is problematic. Yeah. So we need really to switch off, to step away from social media. But people aren't doing that. People are doom scrolling, what they call doom scrolling. You're always on your social media feeds, and you're always encountering this information. It's confusing. It's what the World Health Organization labeled the infodemic in February last year already, when we already started seeing this flood, this tide of information, a lot of it confusing, a lot of it true, a lot of it false, accompanying the pandemic as it went global. Around the beginning of last year, sort of in January, February, it started going global out of China. And this as the pandemic went, so did this flood of information. And then in July last year, it reached such a critical point that UNESCO dubbed it the disinfodemic, because a lot of what we were seeing at that stage around the pandemic was just falsehoods, disinformation. The information space, the COVID-19 information space, had become so polluted that it has at this stage become so hard for people to discern between what is true and what is false. And I mean, at that point, we started talking about how do we address this? Not just, you know, within the disinformation research space, within the fact-checking community, the global fact-checking community. How do we address this? And I mean, it's clear that, I mean, fact-checking can only go so far. Health communication really needs to step into this space. And global health authorities largely missed the step there. Local health authorities largely missed that opportunity. And I mean, my takeaway at the end of the day is that we need health authorities, we need governments to step into this information space when we have emergencies, crises such as health emergencies, such as the COVID-19 health emergency, with comprehensive information. The information has to be clear. It has to be consistent, the messaging, and it has to be continuous. So we need to step into this space, communicating consistently, clearly, comprehensively about the facts of what's happening, what the interventions are, why we have these interventions. There needs to be a great deal of transparency around what's happening. And I think this is the lesson that comes out of this going forward. If we find ourselves in a situation like this again, that we actually are informationally and communicationally prepared to deal with the emergency, because this has become not just a health crisis, it's a communication crisis. It's a trust crisis which has developed from the communication crisis. It's a trust crisis in health authorities, in governments, in authoritative sources of any kind. And that's what the situation COVID-19 has now become. People don't believe anybody anymore. You know?
And I think you have a valid point. I think we've got a number of pandemics, but the disinformation, the trust levels, the communication crises and reactions are teaching us lessons for the future of how to deal with crises. But at least there's a vaccine for COVID-19, but there's no vaccine for disinformation. And maybe what the vaccine you're proposing is more proactive and consistent engagement of filling these gaps of information that people fill with misinformation and disinformation. And that leads us to Mrs. Batia, the UNDP representative to Namibia, who's going to speak to us on a high-level basis about vaccines, about their effectiveness and all the questions that are coming around vaccines, and also just what are the key points that you'd like to highlight from the get-go?
Thank you. And a lot of what I would have said was already said by Dr. Swaminathan. And I mean, this is a message which I think bears repeating all the time, that firstly, vaccines are very critical in building your immunity to the virus. And vaccines are not something new. I mean, people are treating it. We've been vaccinated from childhood, right? We've managed to eradicate such severe diseases like polio and smallpox, etc., with vaccines. So this is not something. And from birth, you are given, you're always given a vaccine. So it becomes a little bit confusing or bewildering to understand why people are so hesitant to take something which builds your immunity, which is so safe, which is effective, which prevents serious illness and death. And very importantly, this vaccine, if you are vaccinated, you not only protect yourself, but all your loved ones as well, right? You are not transmitting any of the virus. You put a stop to the virus going ahead. And this is why medical science has made such amazing advances. We have this medical research technologies, we have different vaccines, and all of these vaccines are considered safe. No matter, it's not one over the other. The best is whichever vaccine is available, go get that. And just coming back from you in terms of the infodemic and the misinformation, exactly. Why would you, I question it like that. Why would anybody not want to protect his or her life and that of his loved ones? Why would you deliberately go in the face of these validated factual statements which are being made? Why is that fear again? And that probably comes up from your point in terms of providing that information. If whoever wants to know something, go to the exact source, get that correct information, and then let's take it from there. And that's how we come in also, because it's about, first and foremost, it's about protecting your lives and the livelihoods. You cannot continue with your livelihood, you cannot continue with your daily activities if you are unwell or infected, or you develop that kind of a weakness. So the vaccines are the ones which will inject that memory. I mean, there is a, I'm not a doctor in that sense to do that, but this is the way it starts your immune system, develops that memory in your cells to fight off the virus and therefore halt the spread of the virus. So, that is how we are coming into the picture, yes, in terms of how we can do our part in spreading correct information, in supporting people to do the right thing.
And that's the paradox. There's something that's causing fear and anxiety. The vaccine is a clear path out of that fear, anxiety, and destruction being caused by the virus. But because of the trust deficit, we don't trust the vaccine, which is the only solution. So that's a quick summary of where we are as people. And luckily, we've got the frontliners here who deal with the patients, with the consequences. So Dr. Brewer, maybe you've got some points you'd like to add.
Yeah, I think, I mean, if we look where we've come from the start in, March last year, where we had our first cases, initially hoping that we would be able to curb the spread and protect our community, to the current wave where we're seeing the massively high numbers of patients being admitted, the frustration of having patients outside that you can't get into a hospital, and the high numbers of deaths. It as a frontline worker, I think it's a difficult period for all of us. And then also adding on that, the frustration of the misinformation that we're sitting with, and the fact that we have a preventative measure in that we can vaccinate. I mean, we've come from where our initial aim was to slow the spread, to flatten the curves, for two reasons. One, to protect our healthcare system, and also to buy time so that we can get something like a vaccine. And initially we were so effective in that, and we were flattening the curve and we were slowing the spread. And then unfortunately we somehow dropped the ball as a community, and then we sit with this rampant community spread and the death that's affecting us all. I mean, all our everybody knows somebody lost a loved one, and it's difficult. And I think we have to look at ways that we can improve our current situation and prevent it from happening in future, because I think we have to look forward and say, how can we improve? I also think as a clinician, it was a rapid learning curve. I mean, from what we knew a year ago to what we know now, there's been so much additional information that research produced and provided us with. So I think we know much more, and we know we're going to learn a lot more. But we have to trust the science. We have to listen to the experts that works with this, and follow the guidelines. We have to trust the science. We must listen to the experts, and luckily we have so many around us. And Dr. Cupido is an absolute expert in infectious diseases, and we'd like to hear your views.
Yeah, so I think I've made three main sort of considerations. The one is that we have to realize that this epidemic has really hit us very, very hard. You know, we've lost a lot of people. We are going to continue to lose people. We're talking about breadwinners, we're talking about heads of families, leaders in the community, educated people, people who are supposed to take this country forward, who have now died before their time. And the loss is not going to be easily remedied. And if there's a fourth wave coming, we're going to lose more people. And with a fifth, and on and on. So we really have to find a way out of this. We can't lock down the country every 6 months. Our only way out is a vaccine. And for people who are not prepared to face that reality, are going to lock us into a perpetual cycle of loss, destruction, and eventually disintegration. We can see what's happening in South Africa. It is accumulation of death, of financial hardship and of a loss of faith in the authorities, because they can't stop the cycle of death. So if we don't want to go on that road, we need to, as the colleagues have said, we need to embrace the science. So that's the first thing that strikes me. The second is looking at our society as a whole. You know, we've had the 10%, 90%. If you are well off, if you have a medical aid, if you have private security, then you are secured from the misery which afflicts the population. And COVID has upset those calculations. When the private hospitals are full, patients with medical aid have to come to the state. And that tells you, in any country, when the chips are down, it's the state which has to step in. So we all invested in a functioning society and a functional state. Nobody, no amount of money buys you out of living in a society which must be just, which must be equitable, and which must look after the poorest. And I think Namibians have woken up to the reality that we are one people, we are living in one country, and we need to look after each other. And the third thing is maybe just for me to pay homage to my colleagues who are in the front line. We've lost colleagues, young colleagues, to this, and in spite of this, they go to work every day facing these circumstances. So I think, you know, a lot of strength has been found in our society. A lot of people have taken the baton, and we've realized that the strength in our society comes from the young. It comes from these young doctors and young nurses on the front line, and these are the people whom we must look to in the future. Yep. I think we must stop celebrating the old. We must invest in the young if we want to move forward as a country.
Thank you, Dr. Cupido. But you say something that's important, that we can't continue with a cycle of lockdowns every 6 months. The two of you see what's happening in the hospitals. Our psychiatrist knows what's happening in our homes, and I'm sure Frederico is upset about the level of disinformation as Alka would be. But one thing you said is what's going to take us through this, what's going to stop the suffering, and everybody has said that, is vaccine. But because we don't trust each other, we are resisting the only solution. And I know that Honorable McHenry Vanani, the president of the PDM, he made a very strong appeal last week for people to vaccinate. He himself had COVID. And I was happy to see that, because if we're not going to unite across political lines, across racial lines, across ethnic lines, across religious lines, and fight this common enemy. We can always fight each other later, but this enemy will defeat all of us. So I think the message that is coming here is, if COVID is not going to unite us, there will be nothing to fight over in 2 years' time. So that is what the experts are saying, and the experts are saying what this conversation is about, that it's about love protects, and each of us have to do our part. And with those words, I'm going to transfer to Blanche, because this is an interactive session. We do have people who've asked questions on our respective platforms, and Blanche will be going through those questions and allocating those questions to the respective panel members.
All right, then. Thank you so much, Madam FLON. Good evening, esteemed panelists. Yeah, we do have questions from the Twitter and Facebook timelines of the Office of the First Lady, as well as the NBC pages. So the first question I will direct to Ms. Bhatia. It's from Sylvia Johannes Simasiku, and she wants to know, she's following, and as well as Jimmy Kambwa. They are following on the vaccine and about the immunity that is being provided by the vaccines. So related to this, they want to know, there seems to be an impression that there are quote unquote better vaccines than the ones available that people would rather wait for. What is your advice to that?
All vaccines are good because they are safe, they are effective, they prevent serious illness, and they prevent death. So the best vaccine is the one which is right there for you to go and get that. And these are vaccines are done with different technologies, etc., but they all go through a very rigorous trial, right, or several trials, right. There are all these first phase, second phase, third phase trials, and after that they are provided the approvals. The WHO provides their EUL or the emergency use listing, and after it provides that, they are rolled out. All the vaccines have been done that way, at that level, and with each country also there are additional checks and balances. Nobody wants to put their populations at risk. So these vaccines, there is no better vaccine. So whichever one you can get your hands on, it's also about now that accessibility and availability of these vaccines. If we are fortunate enough in this country to get vaccines, and I think the government needs to be commended because they are at considerable expense, these vaccines are being procured and rolled out for free. So we should really not hesitate to go for a vaccine. It's a shot of hope. The vaccine is a shot of hope. And as FLON just said, it's not only our individual responsibility, but it's a collective responsibility to ourselves, our family, our community, our country, and the world at large.
Mm-hmm. Thank you, Ms. Bhatia. Dr. Bruvet, the second question is from Luel Gabriel, who posted on Facebook. He shared his observation that 2 cases where individuals who received both doses of Sinopharm vaccine got the virus and later died. Further questioning, is there a link between the current vaccination program and the sudden high number of deaths?
Yeah, sure. I think one has to understand that the aim of the vaccine is not only to prevent you from getting sick. It's trying to prevent hospitalizations and severe disease and even death. Now, unfortunately, not all individuals' immunity works the same way. Some people will not we won't have a vaccine that is 100% effective. Mm-hmm. There's no drug that we have that is 100% effective. What we know from our research in the vaccinations are that they are highly effective in preventing severe disease. I mean, and I'm talking about 99% plus in preventing death in some studies. So I think one has to just take a step back and understand that vaccines aren't there to prevent the disease. Although they do, you still can get it, but the aim is to lessen the severity of the disease. As to the question of the association between the vaccine rollout and the peak that we're experiencing now, I think that is also based on misinformation that we have on social media. I mean, there's so few of us that's actually been vaccinated fully that few numbers can't nearly have that impact on our society. And it's a misunderstanding of how vaccines work that brings this information into the public domain that spreads misinformation with regards to how vaccines work and the impact that they might have on the disease severity.
Thank you. Mr. Langs, I know you have spoken about it in your introductory remarks about the rumors, but then this person still wants to know, with the rumor of Namibia experiencing high deaths because of vaccines is becoming prevalent, where do these rumors originate from?
Yeah, if you look at a lot of these narratives, the death narrative and so on. These are these come out of the anti-vaxxer community, anti-vaccination community, which is globalized with the COVID-19 pandemic, and the anti-vaccine narratives have been coming on since the beginning of this. I mean, this isn't new. A lot of these falsehoods emanate right from the beginning of the pandemic, and they've just been recirculating and become viral again as the vaccine rollout has started since the end of last year in various parts of the world. And so have the death claims. 5,000 and something deaths in the US reported. But if you look at what the US CDC says about these deaths, I mean, none of them have been linked to any of the vaccines. We've had claims about deaths in other parts of the world. We now have figures here in Namibia with large followings on social media claiming that people are dying because of the vaccines. But the numbers don't bear that out if you look at the numbers. I mean, 130,000 people vaccinated. We've got 2,000 something deaths. None of the deaths linked to, at this point in time, to the vaccines. So there's no massive die-off taking place in this country of people vaccinated. 130,000 people, is, we do see the deaths of people who've been vaccinated, but as Dr. Prouvé said, I mean, there are factors there that play a role in those deaths. If you look at some of them, somebody who's 73 years old, comorbidities, underlying health problems. So you're looking at somebody with an immune system which is severely compromised, and this person, there isn't much a vaccine is going to do for somebody like that. The vaccine is supposed to help your immune system, but when you're with age, our immune systems deteriorate. So, and now you've got diseases and illnesses on top of that. So, people, these things are if you just step back and take a look at these things, you sort of realize what's happening. But a lot of this this death narrative comes from this internationalized anti-vaccine movement, and it's disturbing that people are so quick to believe, just anonymous posts, voice notes, posts on especially WhatsApp. I mean, WhatsApp has just become totally polluted. You don't know how to get people away from it. I mean, I'm as a fact checker, as somebody who tries to share factual information on the various social media platforms that as an initiative that we operate on, it's disheartening. It's disappointing to see a lot of this, and certainly it's not true. We don't see the die-offs. We don't see the mass deaths that people are claiming. And I mean, I think I'm taking too long, but I just want to point out something. If you look at these claims, so they were supposed to be when we started the vaccination process in March, this drive, the claim was from one of these people who were sharing this, spreading around this information. People don't take it at Karatura Hospital. A lot of the people there now dying are people who've been vaccinated. And then the people who were vaccinated didn't die off in these massive numbers. Now it's become, if the people who are vaccinated will die in 2 years. And now even, I mean, I've now also seen, where the people who got vaccinated will die in 5 years. So the lie is being adapted because it's not happening what these people are saying. The lie is being adapted to fit the circumstances. There weren't mass deaths when people were vaccinated, so now we have to adapt the lie to say people will die in 2 years' time. People will die in 5 years' time. So, I mean, people need to be aware of this. This is what's busy happening. This is disinformation. It's being adapted. It's being, fit to the circumstances. But people keep on falling for it, which is where the question mark for me is. Why do people keep on falling for this sort of thing?
Well, you spoke about the WhatsApp groups. Dr. Mwambene, This person wants to know, or first stated that fake news is also starting to affect people's relationships. So how can we stop our loved ones from posting fake news and pushing misinformation onto family WhatsApp groups, as it always starts arguments?
Okay, thank you for the question. I think my fellow panelists, they've spoken a lot about the misinformation. And this is true in the media, and especially in the WhatsApp group, as if the question is directed. A lot of misinformation have been circulating in there. And this misinformation, it started when the pandemic started. So there was a misinformation about the coronavirus, and now there's a lot of misinformation about the COVID-19, and a lot of misinformation about the vaccination against now coronavirus. So with the coronavirus, they talk about a lot, like it has been made, it is the target is to decrease population in the world, and especially to kill a lot of Africans. So this circulated that way. And when it comes now to COVID-19 disease also, COVID-19, a lot of misinformation now, it was like, this is not the really disease, it's something that has been made. So this fear and fake information about that affect a lot of people. And especially so those people who have got less access to the real information or the factual information are the majority that are really affected with whatever little they get from the WhatsApp media. And now, like with the vaccine, as my fellow panelists have already said, they are talking about if you'll be vaccinated against coronavirus, your body will turn into magnet. I remember when I was vaccinated, my colleague came and then started to put a coin at my shoulder there where I was vaccinated. Then I was like, what? I didn't know what is going on. They said, no, you've heard that if you are vaccinated, then your body will turn into magnet. Then I was, no, this is not the way. So what I can advise about the fake news, people, let's try to protect our mind. Let's try to look to the facts about coronavirus, the facts about COVID-19, the facts about vaccination. So if we can not get the facts by ourselves, by reading, let's go and ask those people who knows, or try to find the reliable source, like a reliable WHO source, a reliable health professionals, a reliable people who really knows about the whole issues about COVID-19. And also, when you read, or when you start reading the messages, the fake messages that have been forwarded through media. First of all, if you start realizing that this might not be true, don't continue reading it.
Doctor, can I quickly ask a question then?
Yes.
What if I'm that person? I'm your sister or I'm your mother, I'm in the family WhatsApp group, but I'm the one who keeps on putting that information because I believe it. What would you advise, or how would you handle me in a way that our relationship doesn't break?
Okay.
How would you manage me?
Okay. First of all, it's true that this is going on there. So the most important thing is, I'll advise that sister of mine or a friend or whoever sent that information in the media that please don't send if you're not so sure about that information. And that's why now I was insisting now you have to be sure that what you are sending to someone else, it's the fact. If you're not so sure, please don't send, because it will create a lot of fear among people. And it's better to delete immediately. Don't even continue reading yourself, because it also affects yourself. The sender and the receiver are really affected with the fake news. So let's avoid doing that. And the other thing also for us, let's have this practice of not trying to read a lot about COVID-19, because it's really also confusing. We can limit our exposure to information about COVID-19 through media. Mentally, we advise that for a mental well-being, at least limit for 2 or 3 times per week, and have a specific time of a day that you can read. Maybe lunchtime you can go quick and say, what are the facts, what are the new things, that the facts information. So you limit yourself. Limit yourself towards the end of the day, because some of the people, they develop now problem of sleeping because of reading the information that is really confusing. So let's abide of that. Let us limit ourselves on the time that we are focusing or exposing ourselves to the information about COVID, which is not factual. And let's try to be more, try to find out what are the really facts about the COVID-19. If you don't know, you better ask. If you're not so sure, please don't forward the information. And especially for those, especially our parents, our old patients, who they don't know, they can trust. If the child go to the parents, send the information, tell them about the COVID-19, and the parents, they don't have much exposure about the factual information about COVID-19, this really will affect. So let's try to practice this. Don't forward any information. We are tempted to forward, but please not forward all the information that you get from your cell phone or your Instagram or where. Don't forward. Forward only the information that you are sure of. It's better to ask to be sure before you forward or before you communicate the information with the loved one. Thank you.
Well, thank you so much, Dr. Cupido. Ronel van Beek on Facebook wants to know what can we do to strengthen our bodies before taking the jab, especially when dealing with underlying factors?
So, if one has a specific immunosuppressive illness, let's say you're on medication that depresses your immune system, then it's probably best to have your health practitioner advise you as to how to optimize that treatment regimen for you to be able to respond to the vaccine. The vaccine itself is safe, and the vaccine itself will not cause disease in 99+ patients who receive it. So the question should be, how do I maximize, I suppose, my response to? Now, I think in two parts. One is in the time that we are now, in a third wave, probably one should get the vaccine without delay, because the risk of optimizing yourself prior to the vaccine is outweighed by the chance that you will get the virus before you get the vaccine. So if you haven't had the vaccine and if you have an opportunity to get the vaccine, then I would say, unless you've got really urgent health concerns, you should get the vaccine ASAP. In terms of optimizing prior, do the things that you normally should do. Stop smoking, lose weight, stop taking alcohol, and try to make sure that your blood pressure, your sugar, all of those things are well controlled.
Okay,
but there is no reason not to take the vaccine.
Thank you, Doctor. Dr. Brewer, there's a brief question here for you, again from the same person. I'm due for my second shot of AstraZeneca. Will the vaccine still work if I get the shot later than the date scheduled?
The short answer is yes, it will work. And fortunately with AstraZeneca, we actually know if there is a delay in the administration of your second dose, if that interval is longer, it actually works better. So it's not a necessarily a bad thing to delay it by a few weeks. So yes, the vaccine will still work. Sinopharm, we don't know. We don't have as much information on specifically the delay. Probably it will still work. Remember, Sinopharm is a dead virus. It's an inactivated virus. So giving it 2 weeks later or 3 weeks later shouldn't. But with AstraZeneca, at least, we do know that a delay is actually beneficial. So as with Sinopharm, we don't have that data, but probably it will still be effective.
And that was important because the Sinopharm lands on Saturday, so I don't think people are too much out of their time frame. And then we were told this morning by the Minister of Health that they expect AstraZeneca towards the end of next week, or at least within the next 2 weeks. So it's good to hear that it actually improves the response, even if it's delayed, because I know many people are concerned it might have a detrimental effect, and what you're saying is the opposite is true. It has a positive effect.
All right then. Dr. Cupido, the question is on the increasing number of home deaths. What are some of the practical steps that people can follow when a loved one experiences severe disease and is unable to receive medical care in a hospital?
So that's a bit of a difficult one, because severe disease by definition means you should be treated in a hospital. I think what people should try to preempt someone deteriorating to the point that they need emergency admission. In other words, so particularly people who are at risk for developing severe disease and who develop symptoms or have had a positive contact should be monitored closely. If one can afford an oxygen measuring probe, then that is probably the best case, and this is something which you can buy at pharmacies. You place it on your finger and it actually measures the amount of oxygen in your blood. The normal value would be above 94%, but acceptable above 90%. So this is one thing that you could do. But the second thing is, I think if somebody starts experiencing shortness of breath on walking, that is already a sign that that person is not well. That is as far as the lungs goes. So I think three things. If someone's at risk for development of disease, monitor them closely. If you can buy what we call a pulse oximeter, then do so. But if you can't, then I think, and the person starts developing shortness of breath on walking or on daily activities, take that person to a health facility. Do not try to manage severe COVID at home. Don't try to steam. Don't try unauthorized medications. I'm speaking about ivermectin because we have seen multiple patients who have left it too late because they placed their trust in this kind of unauthorized, completely unvalidated medication, and they come to hospital late, and these are the people who have, unfortunately, many of them die either at home or on the way to the hospital.
Can I just extend that question? If somebody does die at home, what are the next practical steps that the family must make? Because we're seeing more and more home deaths. What happens after somebody dies at home and not in a hospital?
So I think the dimension of that question is, what is the risk to the people of moving or manipulating the body? And the second is, of course, that the death must be notified, and the people who come to remove the body should be informed that this, could be a COVID-related death, although we now take those precautions automatically. So the risk to the, in terms of manipulating, moving the body, is probably highest in the initial period, particularly since the surfaces around the body may be contaminated, and particularly since any movement may change the pressure within the chest and cause the person to, even a dead person, can expel active and live virus. So the people who intend to move the body should protect themselves, body covering, mask, should try to, and of course gloves, and I think minimal movement of the body, and inform the authorities as soon as possible.
Well, Dr. Cupido, I think the second one is also related to the first one, but it's from Sylvester Shimuningeni, who wants to know that because of the pandemic, washing, clothing, and viewing of the bodies of our loved ones have been compromised, including the manner in which the funerals take place. So now he wants to know how can a corpse in a coffin transmit the virus, and also can disinfecting the body ensure everyone's safety?
So how a corpse can, I think we've just discussed, is number one, the surrounding of the body, because the person, while they were alive, were shedding virus onto the surfaces. And the second is then, as you said, if you manipulate the dead body and you put pressure on the chest, or you manipulate, move the body, then sometimes virus can be expelled. So particularly in that very early period, as the person has passed, that is probably the higher risk. But the highest risk is at the funeral or at the wake, when people are congregating and many of them will be asymptomatic but will have the virus. So the body is actually a minor part of the problem. The biggest transmission is the mourning process, the wake, and the funeral.
Producer Tutu, for us to have Dr. Amagulu on standby, but while we are getting the doctor online, I have questions here, who is also for Dr. Mwambene. This person wants to know, because of COVID-19 pandemic, more people are experiencing mental health challenges. What are some of the health trends that you have observed, as well as the advice that you can give as a result of the pandemic?
Okay, thank you. What I've observed as the mental health trend now because of the COVID-19, I would like to categorize maybe into three major groups. On the patient trends, on the health care providers trend, as well as in the community. On the patients, I've experienced that post-COVID-19, people, they've developed mental health complications that they didn't have before. Like I've attended 2 patients who they've developed cognitive impairment, including poor concentration, poor memory. Some have slowness in the thinking, speech problems post-COVID-19. And this has been so, and some of the research that have been done, especially there's one ongoing research in Canada by Vox Neuro, they've confirmed that this is a post-COVID-19 complication that is now increasing, and the impact is delaying. It can take even 1 year, 2 years. Some patients, it can have permanent one, but they say with time, with a proper intervention and rehabilitation, they can recover from that. But that is the trend, and I've already seen in 2 patients that I've been attending. And the other thing also on mental health impact of COVID-19 that I've also observed, that patients who have developed a new onset of depression and anxiety, which they didn't have before the COVID-19. And this also has been proven that this also is a manifestation of the functional abnormalities of COVID-19, functional brain abnormalities of COVID-19, that the imaging of patients who develop a new onset depression, anxiety, also even psychosis, including a lot of visual hallucination post-COVID-19. So that is the trend also in terms of the patient. As I said earlier, also a lot of the anxieties. And also among children, also I've seen the children with behavioral problems, behavioral changes, behavior abnormalities. And I have already even seen a patient, a child who is 11 years old with a suicidal ideation because of the loss of the parents. You know, now the orphans are increasing. And that one was double orphan, like both parents have died within a period of 2 weeks. So that boy developed a suicidality, wanted to kill himself because of that loss of the parents. So that's in nutshell, I can say, on the patient side. But also on the health care providers, this has been really affected the mental well-being of us healthcare providers. A lot of nurses and doctors and other healthcare providers, they have a lot of burnout. They're in a lot of stressful situation. There are other call me and crying. They say, "Doctor, we cannot go on like this anymore." And this is because they've been exposed with a lot of patients who are dying. This is not normal. We know at the hospital patients somehow in one way or another they were dying, but the trend that is going on now, a lot of patients are dying, which is also, you know, healthcare providers also, they are human beings, they have emotions. So seeing every day patients are dying, they're trying to do their best to save their lives, but at the end of the day, patients are dying. Breaking news to the family for the death of the loved one, this really affecting the healthcare providers. So this also is the trend that I've seen, increasing number of healthcare providers with anxiety. There's one who came 2 days ago, came to my office, said, "Doctor, I want to quit. I don't want to be a doctor anymore." And she was really crying, saying, "No, I cannot handle this situation anymore." So this is a trend that has been going on, a lot of burnout among healthcare providers, which really complicates to mental health complications, including depression. And the other trend now in the community, as I said earlier, there's a lot of anxieties in the community, and this affects both elder people and the children. There's a lot that is going on among the children with the lockdown, not going to school, limitation of to go to play, meeting friends. So this also contributed to mental health complication as the trend after COVID-19 or going on with the COVID-19. So my advice now, how to prevent or how to deal with this situation. First of all, what I can say, we have to take care of ourselves. And self-care including both the care of your mind, the care of your mental, and the care of your physical, not only like physical well-being, but also your mind. What are you thinking about COVID-19? What are you hearing about COVID-19? What are you believing about COVID-19? We need to purify what we put in our mind and what we believe about the COVID-19 in our mind. And as I said earlier, if you don't know or you are not so sure about COVID-19, you better ask and have the real information, which will keep you at least away from the fear. But also, I have also to advocate the issue of seeking help. Where you think that you cannot handle situation by your own, please seek help, whether it's within the family or friend network or professional help. Especially, I have to insist on professional help. I know there's a lot of stigma about mental health or contacting psychologists, psychiatrists, or any mental health provider. But really, during this time of COVID-19, a lot of people are suffering from mental health complications, and they are keeping to themselves because of this stigma. Please seek help, come to us, say what is bothering you so that we can help you. Also, let's learn how to develop the good coping strategies. Let's not cope by using drugs like alcohol or other substances, because this will make more harm to our immune system, to our mental well-being, even to our physical health. So the good coping strategies, which is also very important. At workplace, also I can insist, or I can ask, or I can request the managers, the supervisors, whoever is the leader at workplace, really let us have concern with the mental well-being of our staff, our juniors, colleagues. Let's help each other. If you see your colleague at work is not doing so well, let's offer support. And the leaders also, when someone feels like he cannot handle, she cannot handle, maybe she suffered a lot from the loss of loved one, or there's something that a sick person, let's offer help and let's try to understand that, because the mental well-being at workplace is very, very important. And sometimes if you find someone is vulnerable, let's try also to, if it's possible, it's applicable at that particular nature of work, let's try to, I cannot say recycle, but at least move from high-risk area to lower-risk area, so that to kind of distressing the situation. Let's now, someone who is vulnerable, already experienced stress, cannot handle the situation, also keep on working on a higher risk area. I can also give the example, there's a doctor who was working in a COVID ICU and was really tormented with the situation at the COVID ICU. So at least she came to us, we tried to offer the intervention, and also we discussed with the supervisor. The supervisor was very understanding. Then she moved from that high risk area to another area that at least she's able now to cope. So these are the things also we need to consider. And also maybe our healthy diet. Let's consider healthy diet. Let's have this healthy lifestyle. Exercising, sleep hygiene. Sleep is very, very important. Let's try to have enough rest, which is very good also for our immune system. And
I think that's fantastic feedback. And these are all very, very practical ways that each individual can make sure that they look after themselves.
Yes.
And I think even for pregnant women, and that's why we're so eager to listen to Dr. Amagulu as well. So Blanche, if you could...
on the line. Dr. Amagulu, here are some questions from our social media pages.
Good evening.
Yes, Doctor, can you hear us?
Yes, I can.
Thank you so much for joining in. Here are questions with regard to how the COVID-19 affects pregnant women. Can it be transferred from mother to baby? Can they get the COVID-19 vaccine while pregnant or breastfeeding?
Mm-hmm. Thank you so much for the question. One, I think pregnant women are susceptible to getting COVID-19 as much as non-pregnant women, but they tend to have a higher risk of getting severe COVID. And I think that's the biggest concern. But the majority of pregnant women who will or who may get COVID, more than 90%, will recover, will do well, but that risk for severe infection and naturally, consequently, hospitalization is there. Certainly, the vaccines have been noted to be quite safe in pregnancy, though the data available is limited and has really been in the obstetric population in America and has been noted much more with women who received the Moderna and Pfizer vaccines, and there have been no issues related to safety or vertical transmission. None has been recorded. There have been a few cases of the virus being picked up in the placenta or the membranes, but questions around whether or not vertical transmission is there for those babies, neonates, that do test positive for the virus are around whether or not the baby might have been infected around the delivery. But certainly we are recommending and advocating for pregnant women to be vaccinated simply because the risk of severe COVID is higher in this population. Yeah.
Mm-hmm. And then the question is, as a Ministry of Health official, Francois Smith wants to know, with the current vaccine shortage in the country, is there anything that can be done to increase vaccine supply, be it from pharmaceutical companies or medical aid companies, or can it only be done by government?
Certainly, government is not only the only one that is providing. Well, currently, government has been the only one providing vaccines, but I think a public notice went out towards the end of March, I think the 31st of March, that allows wholesalers and distributors to bring in vaccines from reputable sources to increase what is available in country and to distribute it. And I think there were guidelines as to these private providers, what they would need to have in place in terms of providing and distributing these vaccines. So the question is, yes, private providers can bring in vaccines into the country, and there's an official notice to that effect.
Mm-hmm. And just before I hand over to the First Lady...
Can we skip that and rather give Dr. Marulu a chance to give her final wrap-up about what her key points are before we go into everybody else, rather than going to another question for her?
Okay, then.
And then we can start with her and then move through the panel.
Ron, can you just repeat that question, please?
So there was a question, but it's already been asked around variants. And I think what I'm trying to get right, Dr. Marulu, is we're going to start wrapping up, and I'm going to give every panelist 2 minutes just to wrap up their high points. And I'd really like to start with you.
My high points really are pregnant women, because I'm an obstetrician, should get vaccinated. Obviously, we want to maximize immunity simply because this population is at high risk of severe COVID. We've seen the cases. They don't do so well. Even the progression of the disease tends to worsen in pregnant women than in non-pregnant women. So I'm highly recommending pregnant women getting vaccinated. Clearly, though the data is limited on safety and whatnot, what is available is quite reassuring that these vaccines are safe. That is the one. So pregnant women should be vaccinated. Even breastfeeding ones should get vaccinated. That's the strongest thing. And I think the other appeal is with the high rising numbers of deaths in the community, people dying at home, it's an indication that for some reason there's a fear of coming to health facilities to seek care. And we really want to say we are here for you. Please come. And you'll have better chances, especially as indicated by Dr. Kipido, when symptoms of severity are setting in. Difficulty when walking, difficulty when doing daily activities of life are setting in for those that are being managed as outpatients. Please come to hospital. So, of course, clearly we are not winning on that score.
All right, then, Madam First Lady, with the remaining few minutes, the floor is yours.
Excellent, thank you. And I think I'll start with the doctors to just finish off where Nelaro started. We've got exactly 10 minutes left, so I think it's 2 minutes each panelist. Dr. Cupido, and you've got a fantastic bedside manner. You've got this calming voice. But if you could speak just a bit louder.
Yeah, so I would say thank you, First Lady. Yes, we're all in this together, and we need to protect ourselves, protect each other, which means wear your mask, socially distance, don't go to gatherings, sanitize where you can, and above all, get yourself vaccinated. You know, we are not going to get out of this thing piecemeal. We're not going to get out of this thing one by one. We can't have our cake and eat it. We're either all in or we're all out. So please do what you can, not just for yourself, but for everybody else as well. Otherwise, this hell will just continue. And we'll be sitting, if we're lucky, at the same place next year, talking about the same things, but with a much smaller audience.
Sure. I want to repeat that. If we're sitting talking about the same things next year, we'll have a much smaller audience. I think that's a stark reminder about what we're facing. Dr. Brewer?
Yeah, I would also like to start off with thanking you, FLON, for this initiative, because I think if we look where we started 6 weeks ago, at the rise of a pandemic, I think one can also have a bit of hope. We're starting to see now in the hospitals that the bed occupancy is coming down, the new referrals is coming down. So we are managing. I mean, we're getting things right. And I think as a message, I would like to add on to what Gordon just said, is that we're all in this together. We have to trust the science. We have the opportunity to prevent progression of this, and we have this opportunity, and we should take it. I mean, as a population, we should really stand together and remember that love protects, and we need to protect each other by taking the vaccine and trusting the science.
Yes. And how we can protect you guys who are doctors is by vaccinating. So you and your families are protected, but that you don't have to see this carnage in your hospitals every day.
Yeah, we don't want to do this. I mean, I think if you ask any of the doctors working on the front line, we never thought we're going to be in a situation. Studying as a lung specialist, I, not in my wildest dreams, thought I'm going to be working in a pandemic with a primary respiratory disease. So we don't want to be here, and we would like to ask the community to do their best to curb this disease.
Thank you, Doctor. And thank both of you, because I know that you have such a long patient list of people that you are looking after. I'm sure your phones are ringing with your critical care patients. So for you to take time out to come and do this, I don't know how to thank you. So thank you, and everybody else. And Alka?
Yeah, thank you, and thank you for having us here today. I think this has been an excellent session, and I'm so happy to be part of it. But before that, it's not only thanking these doctors who have actually laid their lives out on the line, but all our healthcare workers, no matter what. And I mean, this is the kind of a feeling we should have, to see to how we protect our own brothers, sisters, friends, family, everybody, and that's why vaccination is so very important. One other thing I would just like to add, people talk about livelihoods, we don't want lockdowns, yes, we don't want lockdowns, we don't want economies shut, we are suffering. Vaccine hesitancy, vaccine delays, accessibility of vaccines is causing African countries, a loss of $14 billion a month. These are our preliminary estimates. I mean, can we afford to continue like this? Don't we want our tourism to open up? Don't we want Namibia to get out of the red list? Don't we want to welcome tourists? Don't we want our industry to grow, thrive, our businesses to thrive, for us to lead normal lives? And the only way we can do it is vaccinate, 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 and keep on all or follow COVID appropriate behavior, because the health of each one is the health for all of us. So we have, as I said, the individual and collective responsibility, and there is, and everybody who can should come forward and strengthen the hands of the ministry, even in terms of this communication. And I think this is exactly where we are headed for. We know the ministry is overwhelmed. They are trying to put out whatever they can, but each one of us also has a responsibility to do our part. So love protects, and let's do our part.
Fantastic and powerful end. Thanks. Frederico?
Yeah, I mean, I think, I mean, we all have to, my message would be sort of twofold. Firstly, for health authorities, I mean, it should be the experts at the front communicating. It should not be left to people like me, journalists and so on, because we can get it wrong. We can misrepresent the facts of the situation. And if I have, I mean, I apologize if I've misrepresented any of the information here. And I mean, so I would like to see more of that. I would like to see more the experts at the front communicating to the people. And what I would also like to see, and I think this is where we should be headed, this is where other countries are headed, is comprehensive media and information literacy, starting through the school system to address what we're seeing in terms of the information pollution and social media use. There really needs to be investment in that, in media and information literacy. And then for the public, I mean, for everybody watching, I just like to say, nobody wants to be the person who spams their friends and family and associates with lies. You know, don't be that person. Don't be the person who spreads lies to friends and family and associates, because it could have real world harmful consequences. It could cost people, actually cost them their lives. And I think this is what's busy happening. Although we don't have the quantified data on this, I suspect the lies and the falsehoods and the hoaxes and the conspiracy theories are costing people lives in this country. I think that's where we see the home deaths. I'm going to put my neck out there. That's where we see people not going to health services, self-medicating with unapproved medications. That is disinformation. So please don't be that person. Don't be the person who spreads lies to your friends and family. Rather be the person who spreads verified information, who stops when somebody is sharing something or forwarding something into your family WhatsApp group. Rather be the person that takes the time to verify the information. Every question that has been asked here, there's an answer for that question, and that answer is available. My first go-to is the World Health Organization's COVID-19 web pages. Every single question somebody can ask about the vaccines, there's an answer there. They've answered these questions. They're simple, they're accessible, and if you have the data, go there. Verify the information before sharing, before forwarding. Be that person.
Be that person, don't be that other person. And it can cost lives. And what everybody else is saying, that some of these deaths are preventable through vaccine, and we can prevent deaths as well through sharing the right information. And then if we could wrap up with you.
Okay, thank you. I would like to take this opportunity to thank you for having this opportunity to be part of the panelists this evening. And I would like to say that I'm so glad that I've been able to share about the mental health and COVID-19. And maybe to wrap up, I have to say that mental health and COVID-19, there is I can say a chicken and egg phenomena, whereby mental health can lead to risk for someone to acquire infection of COVID-19 by maybe not be able to understand, to comprehend, or to abide to the rules and regulations for how to prevent themselves from getting the corona infection and having COVID-19. But also it's the fact that there is a link between COVID-19 and mental health. And this can either be direct or indirectly through the psychological issues and poor coping skills about the whole issue of COVID-19. COVID-19 also can exacerbate or can precipitate the pre-existing mental disorders. And also, as I said earlier, the direct link now of COVID-19 and mental health, either because of the physical manifestation of it and affect also the brain functionality and really to mental health problems. So I would like also to say, let us also, a lot have been done when it comes to physical management of COVID-19, but also let us put also our efforts on addressing the mental health issues when it comes to COVID-19.
And that's important.
Yes.
And we've run out of time with that. We've been at this for an hour and a half. It doesn't feel like that.
Yeah.
And all I can say is thank you to each one of you. It's
Thank
been
you.
such an exceptional platform to hear each one of your expertise. And I agree with Frederico. We must listen to the experts. You know exactly what's happening. I want to thank Dr. Swaminathan from WHO. I want to thank each and every one of you and everybody who's participated on this platform. We're taking it fully Facebook from now. We're not going to be doing the NBC live sessions. So I want to take this opportunity to thank NBC for just fantastically and professionally managing these Love Protect conversations. Blanche, you're a superstar. I don't know how to thank you for the manner that you've engaged this. And to all of the other experts that have been part of this panel, thank you very much. There's so many of you, I can't mention you by names. And in 2 weeks' time, we'll have a Facebook Live. It won't be live on NBC, where we'll be dealing with some of the issues around the economy. Later, we'll talk about how it impacts people with HIV, and then we'll have a youth town hall. So the programs will continue, just not on NBC. And thank you to you, the viewers, for your many questions, for your engagement. We're very grateful. Love protects.
Hey, thank you. Thank you.
I'm grateful.
Dumelang manamibia a mantle leina la me ke Mpho Slinger. Ke morulaganyi wa mananeo a botsogo mo lefapheng la botsogo. Mo Namibia mogare wa COVID-19 ke matshosetsi go batho botlhe mo lefatsheng go akaretsa nna le wena. A re thuseng lefapha la botsogo go ka koafatsa kanamišo ya mogare wa COVID-19. O kgona go tsaya mokento o ka thusa mmele wa gago go lwantsha mogare, mme le gone mokento o na le mošola o latelang. Fa o ikentile o tlile go ka nna le mošola wa gore o se tla o bona bolwetse jo masisi. O tlile go fokotsa jalo sebaka sa gore o tsene mo bookelong, mme le gone go fokotsa tiragalo ya loso. Kgato e nngwe e o kgonang go ka e tsaya ke go sa anamise melaetsa e seng ya nnete mabapi le mogare wa COVID-19 kana melaetsa e leng gore e kgatlhanong le maiteko a lefapha la botsogo. Go botoka gore re tswelle go ka phara jalo seithibeletso sa rona, go tlhapa diatla tsa rona, mme le gone go ikgapa jalo mo diphuthegong jaaka diphitlho, manyalo. Nna le seabe mo go lwantsheng mogare wa COVID-19. Tsaya mokento wa gago, supa lorato, o sireletse ba e leng gore wa barata le ba e leng gore ba gaufi le wena. Nna ke setse ke tseile mokento wa me kgatlhanong le COVID-19. Dira karolo ya gago mme o itse gore lorato lo a sireletsa.